I'm John Goodman. I'm president of the National Center for Policy Analysis. The NCPA is a think tank. We draw on some of the best and brightest scholars at colleges and universities in this country and really all over the world. And we tackle some of the nation's most difficult public policy problems, such as Social Security, Medicare, regulation, taxes, education. We believe in finding private sector alternatives to government programs that aren't working. And at the NCPA, we believe that ideas have enormous capacity to cause change. We believe in empowering individuals to allow them to use their intelligence, their creativity, and their innovative ability to solve their own problems and the problems of others, often in the context of a competitive marketplace. We are headquartered in Dallas, and most of the scholars that we work with are outside the Washington Beltway. There's a reason for that. We want to rely on the creative thinking of people who aren't worried about what Congress will do today or tomorrow. We want to find the right solutions, and once we've found them, and when it's appropriate, then we'll take these ideas to Washington. In the meantime, we have a very active Washington office, which daily is on Capitol Hill talking to representatives and senators, and also to people in the executive branch. So our Washington office focuses on the issues that are before Congress right now, and we have scholars around the country focusing on issues that we know Congress is going to have to deal with tomorrow. In the think tank world, you can't patent an idea, and it's often difficult to know what difference a think tank has made. But most people would point to 4 or 5 things, major policy changes, that would not have occurred but for our organization. For example, because of our concept of health savings accounts, more than 23 million families are now managing some of their own health care dollars, and it's the fastest growing product in the health insurance marketplace. Because of our concept of the Roth IRA, more than $250 billion is now in the marketplace. This money will be for retirement. It has been taxed once, and it will never be taxed again. Because of another NCPA idea, the 78 million baby boomers will be able to reach the retirement age and keep on working without losing their Social Security benefits. And another idea that came from our organization with the cooperation of the Brookings Institution. It was sort of a left-right coming together. It was a change in the 401k laws that now permit employers to automatically enroll their employees in 401k plans with diversified portfolios. As a result of this change, in the future, employees will have larger returns and safer returns, and will have a much healthier private pension system. For the future, we see 3 forces coming together like a perfect storm. On the one hand, we have healthcare costs growing at twice the rate of growth of our income, and eventually they will crowd out everything else that we are consuming. We have entitlements programs, which are partly healthcare themselves, where we have made enormous promises, but we have not saved, we have not invested, and therefore we have huge unfunded liabilities. And the third issue is taxes. We're going to need enormous increases in taxes to pay for those promises, and yet the increases go far beyond what the public is going to be willing to pay for. So these 3 forces are coming together. And the issue for the political sector, the issue for Congress, the issue for the executive branch is what are we going to do about it? And we hope to use the think tank world to show people how you get from here to there, how you take an impossible situation and make it better. And we believe that requires fundamental change, it requires empowering individuals, and it involves accepting a philosophy that in the entitlement world, each generation should pay its own way, each family should pay its own way, and each individual should pay its own way, and then and only then should we turn to government.